So, hello everybody. Welcome to this webinar on single window services, models, international experiences, and the country case of Brazil, Cadastro Único. I guess for some of you is morning, for others afternoon, and even for others night. So thank you for tuning in. This webinar is organized by the German Development Corporation through the Global Alliance for Social Protection and the Sector Program for Social Protection implemented by GIZ. I would also like to take the chance to state that the webinar was a joint work and several people were involved in the organization. So thanks to my colleagues February Curry, Cecilia Chavez, and Sandra Grail, who did a great job on this. My name is Alicia Spengler. I'm a technical advisor for social protection at the GIZ sector program for social protection. I'm based in Bonn, Germany. And it's my pleasure to facilitate this webinar today. So before we start, I would like to take the opportunity to introduce you quickly to two publications on single window services published by GIZ on behalf of the Ministry for Economic Cooperation and Development, BMZ. The first one is the study called Integrated Public Service Delivery for Social Protection, International Experiences with Single Window Services, which aims to give an overview on international examples of single window models in the field of social protection from emerging economies and developing countries. And the study compares main features and provides an analysis to guide the design and implementation on single window models. Thereby it provides a typology in terms of the scope of services offered by single window models across countries, from small-scale pilots to countrywide systems, and compares strengths, features, and suitability in different contexts. This study was authored by an independent consultant, Mrs. Charlene Ramikson, and coordinated by a former GIZ colleague, Mrs. Martina Bergthaller, who is today one of our presenters and will introduce you to the outcomes of the study, which has actually been completed by the report of a peer-to-peer global practitioners learning forum called Single Window Services for Social Protection, which took place in Jakarta, Indonesia, and where we counted with several country participants, actually Brazil, Chile, India, Indonesia, Peru, South Africa, and Tajikistan. And the experiences were registered in this report, which you all can, both reports you can find also on socialprotection.org. The links will be provided in the chat bar afterwards. So just on the agenda of this webinar, we have 1.5 hours in total. We will start with the presentations, one being done by Martina on the single window services concept, and the other one by Marcos de Souza e Silva on the Brazilian experience with Cadastro Único and the role of single window services. So quickly on Martina, she is an independent consultant specializing in the design, implementation, and evaluation of social protection policies and programs with a focus on social assistance and single window service models to improve access to social protection. She holds a master degree in political science and a master degree in development studies from the University of Vienna. Before becoming independent consultant, Martina worked for various social protection programs at GIZ. So I would like to hand over to Martina so that she can start with her presentation. As we have a lot of content today, I don't want to speak any longer. Please, Martina.
Okay, thank you very much, Alicia. Hello, good morning, good afternoon, and good evening, everyone. So I'm very happy that GIZ invited me to present the results of the single window service study and the peer-to-peer learning workshop in this webinar. Before starting my presentation, I also want to give the credits again to Charlene Ramkison, who was the main author of the study on single window services. And I also wanted to mention my colleague or my ex-colleague, Mr. Cormac Epken, who was the co-author of the workshop report that I'm going to present. So next slide, please. Okay, so I'm first giving a short outline of my presentation. So today I'm going to introduce to you the concept of single window services. I'm going to introduce to you what are single window services, what are we talking about when we talk about single window services, what are the basic elements of single window services, and what are the benefits of them. So why should countries implement single window services? Then I'm going to introduce to you the 3 single window service models that are also outlined in the study. They are defined by the scope of services that they are providing there, and I'm going to give a few country examples where single window service pilots are also on a large scale. Country examples are already implemented. And if there is still time, I'm also can give you some key design issues and implementation considerations. So what are the challenges when implementing single window services and what to take into account when designing and implementing them. So next slide, please. Okay, so let's start with an introduction to the single window service concept in the context of social protection and a short definition of the term. Next slide, please. So what are we talking about when we are talking about single window services in the field of social protection? The study defines single window services as integrated social service deliveries in the form of a contact point for beneficiaries or also potential future beneficiaries of social protection programs and other social services at the local level. And there are 2 important features of single window services. The first one is that the single window service is offering one window or one single entry point for clients for not only one program, but various social protection programs and also other social programs. And it provides various services related to these programs, like, for example, a provision of information to the clients, the referral to responsible authorities, the eligibility assessment, and also the support with the necessary documentation and the applications. I'm going to come back to these scope of services later when we talk about the single window service models in a few slides. Another important feature, or the second important feature, is that the single window service approach is streamlining and devolving in different tasks related to social protection schemes to an institution which is responsible for the single window service office. So the different tasks are not in the responsibility anymore of the different authorities responsible for the programs, but they are devolved and streamlined and then given to one single authority related to the operation of the single window service office at the local level. So next slide, please. Okay, so this slide is showing the basic elements of a single window service for social protection approach. Basically, we have a front office, which is the first and foremost contact for the clients accessing the single window service. And this is usually a physical space staffed with specialized staff where clients can go and where they can attend to get information about access to various social protection schemes. Then we have also some back office functions, and this is the coordination mechanism between the single window service office and the respective providers and authorities of the various schemes that are the authorities that are responsible for operating the various schemes to proceed claims and applications. And usually nowadays single window services also contain a mechanism to collect information of clients in an electronically in a management information system. Usually this management information system is also coordinating and cooperating with program management information systems. And in ideal cases, there is also an interoperationality and an exchange of data between program management information systems and the single window service management information system. So next slide, please. So why should countries implement single window service approaches? There are several benefits for countries. So there are demand side benefits, supply side benefits, and long-term system benefits. When we talk about demand side benefits, we basically mean the benefits that clients have when accessing a single window service. So single window service can contribute to improved awareness on social protection schemes. They can provide clearer and more transparent information about social protection schemes, and they can also reduce direct and indirect costs for the clients approaching the single window service centers. On the supply side level, on the supply side benefits, we can see that single window services reduced application costs in outreach, registration, and enrollment. They are also eliminating redundancies by streamlining processes and procedures. They can lead to more efficient distribution of tasks between authorities involved in the provision and delivery of social protection schemes, and they can also contribute to link and share information between programs. And this also leads to the long-term system benefits, which is, single window services can provide a mechanism to improve, for example, the budget planning in the field of social protection. They can also improve informed decision-making in broader social protection reforms because they can provide information about which programs work best and which one should be extended and which programs do not work and also could be skipped. And last but not least, they are also providing a mechanism to set up and extend electronic single registries because they are providing demand-side registration mechanisms and an integrated management information system that is connected to the program management information systems, and also sometimes to civil registries or other databases like databases of the tax authority. Okay, so next slide, please. So now I'm going to the 3 models of single window services that are also outlined in the study, and I'm going to give you a few country examples. Next slide, please. Next slide, please. Okay, yeah, here we go. The single window service models that are defined in the study are defined according to the scope of services that they are providing. On the very left, we have the single referral point, which is basically providing the client with information and of available schemes. They are also assessing the client. They are referring them directly to service providers. What they don't do is following up on the registration process. So the client is ultimately responsible for registering for benefits on their own. And the work of the single referral point ends with the referral of the clients to the respective authorities. This is different in the second model, which is the single entry point. This is the one in the middle of the slide, so the green one. It is fulfilling all the tasks that the single referral point is fulfilling, but additionally to that, it also has an important role in dealing with applications on behalf of the client. So it is supporting the client with filling out the applications and the collection of all necessary documentations. It is also verifying the eligibility of the client, and then it also takes up responsibility to follow up the applications on behalf of the client by forwarding them the documents to responsible authorities, who then decide on the enrollment. And usually they are also giving a feedback to the client on behalf of the responsible authorities as soon as enrollment is decided or not decided. So the last model, the third model, is the one-stop shop. And the one-stop shop is basically based on the idea that bringing together different actors from different authorities responsible for various social protection schemes and also other public services at a single location better serves the client by making it easier to access social protection schemes and social services. So because of this co-location of officers from different authorities at one single window service office, they can also provide the full range of services of social protection programs, starting from the information to the assessment, to the application, up to enrollment, and in certain cases also the provision of services directly at the single window service office. Okay, so next slide, please. Next slide. Okay. So this slide was originally animated, which made it a little bit more clear, but I think this was lost now. Oh yeah, here we go. Okay, so I want to give you a few country examples, and I'm going to start again with the single referral point. So the single referral point, or examples for the single referral point model, can be found in Southern Africa, where community referral mechanisms specifically targeted on families affected by HIV/AIDS are implemented. And there is also one very interesting example in Indonesia called the Integrated Referral and Service System for Prosperous Society, which is currently being rolled out to 150 districts and cities until 2019, and also supported by the Australian Development Corporation there. So could you click, please? Okay, so the second model, the single entry point, you can see that there are a lot of different examples, and this is the one that is internationally at the moment the most prevalent of the three models. But you also have to take into account that many of the country examples that you see here are currently in a pilot stage. So the most well-known examples for a single entry point are definitely the Latin American examples, Chile and Brazil. And there they are also an important part of the integrated social protection system of the country. And we are going to learn more about Brazil in the next presentation. So I'm not going to go into detail here. China is also another example where the social protection community services are implemented on a country basis. They are currently, or in 2014, they were present in 45% of all urban communities. So this is another single entry point example. And all the other examples that you can see here are currently in a pilot stage and are supported either by GIZ, the International Labour Organization, or the World Bank. Yeah, could you click, please? So yeah, so these are the examples for, or the current examples that we have found for the one-stop shop. So there is a one-stop shop, which I want to point out here in South Africa, which is called the Integrated Community Registration Outreach Program for Excluded People in Rural Areas, shortly called ICROP. And this is very interesting because this is a mobile unit moving around in different areas based on fixed schedules for each community. And these mobile communities are staffed with staff from various government authorities responsible for the respective schemes. And thereby they can provide, they can directly process on-site applications and registrations, and they also can issue certain civil registration documentations necessary for the application for social protection programs there. Okay, so this, the slide is not so, I think it's not like complete. There might be other examples, but according to the research that we have done for the study and also for this presentation, these are the most prominent examples that we found in emerging economies and developing countries. Okay, so next slide, please. Okay, so what the study is also doing is comparing the demand-side benefits for these three different models that I just introduced. I'm not going to go into detail here, but I just wanted to mention that all models have their strengths and weaknesses, and you will find a very complete assessment tool in the study on page 18 and 19 to assess which goals or which objectives can be reached on the demand side as well as on the supply side with which model. So they all have their strengths and weaknesses, and they also have their costs. So this also has to be taken into account. Maybe we can, yeah, next slide first. So this slide is showing, whereas the last slide was showing the demand side benefits, this slide is showing the supply side benefits of the different models. And if we click on the next slide, please. Here, and maybe click again directly. Yeah, So here you can also find a comparison of the extended investment costs that you have to invest versus the benefits for customers which the models have. Here you can see that, for example, the single referral point is of course the model with the lowest investment costs when it comes to management information systems, to trainings, and also to physical locations. But it also has the lowest benefits for citizens when it comes to distance to services or to the number of visits of case managers or social workers, and to the outreach. So it is very similar with when we compare the extended investment costs also with the demand side, with the supply side benefits. Maybe we can show the next slide. Yeah, so here again, we see that the single referral point in terms of investment costs is the most economical. But when it comes to operational cost savings, the two other models, the single referral point and the single entry point, have more benefits, and so it might be worth to also invest a little bit more into these systems, so to also get out more of it and to also reach more objectives with the single window service approach. Okay, so we can go to the next slide. Okay, so last but not least, I also wanted to mention a few key considerations for the design and the implementation of single window services. So you can go to the next slide. So when it comes to implementing or to designing single window services, there are also several, let's say, challenges that you have to, that countries are usually facing. Like, for example, with the implementation of standard operation procedures, which have to clarify the processes, roles, and responsibilities of all actors involved. Then there are several questions related to the staff that have to be answered when designing and implementing single window service. We also have to think about information and outreach mechanism, especially if you want to reach marginalized population groups. So how to reach them, which kind of outreach mechanism you want to reach to really inform this target group that single window services are actually working on the local level, and how to make sure that these people are also approaching, or this target group is also approaching, the single window service offices. Another very important issue that we are going to hear also in the Brazilian example is the integrated systems of information management that often has to fulfill multiple tasks. So they are often very important for management, for monitoring and evaluation. They are very important for the case management of beneficiaries, and also in terms of coordination mechanisms. Next slide, please. Another key consideration is how to assess functionality, performance, and outcomes of single window service models. And for this, you need a proper monitoring and evaluation system, which might be connected, or which ideally is connected to the management information system that I was mentioning before. Then there is a need normally for mechanisms to strengthen both vertical and horizontal coordination and cooperation, also in order to make single window service functional. And last but not least, it also has proven in several country contexts that a modular approach might be suitable. So to start first in a single window service model with selected programs and a limited scope of services before fully rolling it out and extending it to just test what works and what doesn't. And if the model is proven to be successful, it can be extended at a later stage also to other programs and to other scope of services. Yeah, so that's it. Next slide, please. So these are the two publications commissioned by GIZ. I think the presentation will be provided afterwards, and if you click on the presentation, you are directly linked to the website of the two presentations. You will find much more information about what I was telling now here in the presentations, and we can also afterwards discuss if you are interested in further details of what I have been presenting. Thank you very much, and I'm handing back to Alicia. Thank you.
So thanks, Martina, for this very interesting presentation. I think I was right that I didn't present all our speakers and discussants in the first round because it took some time for this first presentation, and we want really to have time for the questions and answers session at the end of the webinar. So please already post your questions to the chat, which you can find on the right. So now I would like to shortly introduce the case study on Brazilian's Cadastro Único. Brazil operates a unified registry called the Cadastro Único, which enables eligible citizens to access a wide range of social protection programs and services offered by diverse ministries and government agencies. And households can register with the Cadastro Único by visiting their municipal offices and undertaking an assessment to define their eligibility for and access to a range of social protection benefits. And we will hear more about this by our second speaker, which is Marcos de Souza Silva. So Marcos is a planning analyst in the Brazilian federal government, currently working as a general coordinator for planning and monitoring at the Ministry of Social Development, and he has an MBA in social policies management. Please, Marcos, the floor is yours.
Well, good morning, good afternoon, and good evening to everybody. First, I would like to thank you for the invitation. And before starting the presentation, I would like to thank the whole team that is together here in this room. You may not see them, but I'm just the voice. They are the real knowledge for this. So thank all the group that has supported us to do this presentation. Next slide, please. So we're talking about the Cadastro Único in Brazil. And maybe we should start by telling you what it is and what it should be. In our point of view, Cadastro Único is a powerful, maybe the most powerful planning tool that we have in Brazilian government. This is because we consider information as the basis to plan every social policies. We definitely want to know our public. We definitely need to know our public so we can plan, we can do things in the right dimensions, in the right places. And as you all may know, Brazil is a huge country. We have significant diversity among our population. Not only telling things about income and urban conditions, but we have different ethnic groups, we have different nature conditions, we have places with very difficult access to government to deliver public services. So with this information on the Cadastro Único, we started to know our population. It is by far the most valuable databases that we have concerning the public, our public. And this is why is this so important? It is because Brazil has is a federation. We are here in Brasilia, our capital. We are very far from reality. We definitely don't know what happens in local governments. We can only guess what is happening, in a little city on the Amazon River, alongside the Amazon River. And with this information, since it has begun, we started to realize that we should change many things so that we could deliver proper services and attend people's demands. This was a great changing in the governance model in Brazil. It's a collaborative platform, and we definitely would like to keep on breaking boxes with this mentality. integrating people, integrating ministries and departments with information is the best way to break this process. So the Cadastro Único is a tool for identification and social economic characterization of Brazilian low-income families, but it's not only for low-income families. Even those who are not considered low-income families, that is, the definition is in the slide, monthly per capita family income up to half minimum wage, or monthly total family income up to 3 minimum wages. But even those who are not, who do not fit in this definition, they can be in the Cadastro Único if there are some public policies that were designed to other people that are not inside this profile. Next, please. Besides gathering this information, one of the major worries in handling the databases is sharing information. So, as we are a federation, as we have considerably autonomous local governments, federal government doesn't interfere directly in how the work is done in the territories. But no municipalities they would not be able to collect this information and to deal with so much information, because most of the times they are, shortage of resources. They do not have people, they do not have equipment, they do not have technology. So we gather this information, we will share with everybody who could use it properly. Next, please. With this registry, and there are many information, many different fields of information inside the unified registry, the Cadastro Único. We collect data about family composition, about water supply, energy supply, basic sanitation, ethnic characteristics, years of schooling, people with disabilities, where they live and what disabilities they have, their labor positioning, their income, their expenses, and many other informations that are inside the databases. You can access this online. This is the place where you can access it, and it is available in Portuguese, English, and Spanish. So you can download all information regarding this databases at the Unified Registry. Next, please. It is formally established. There is a federal decree from 2007 that established the rules that we have to follow with the Cadastro. It is used for all. It should be used for all social policies. Every citizen that would like to access a social policy coordinated by the federal government should be inside the Cadastro. We have this tool working in every municipality in Brazil, and the way that it works varies a little. And again, I insist in the fact that we are a federation, so we cannot interfere in how municipalities they want to do their jobs. We cannot have this kind of hierarchic command to unify their way of interact with people. But even though there is a kind of flexibility, some surprising numbers have been achieved so far. Next, please. We have 60% of the the Cadastro Único, handled by social assistance facilities. So this is quite a surprise when we think about Brazil with 5,600 municipalities. So we have been able to achieve 60% in a kind of standard facility of social assistance. Registering people, we have many objectives doing this, but the central one is to identify and characterize the vulnerable group of Brazilian society. Now we have almost 40 or 50% of Brazilian population inside single registry, inside the Cadastro. So this counts to 100 million people identified and characterized on our database. Of course, this database is demanded and is actually used by many sectors of Brazilian federal, state, and local governments. So as long as we now can, we know better people's condition, we can do a better dimension on what we need to do. So how many people, how many homes do we have that needs basic sanitation? Where are them if they are located in some specific points of the territory? Where we can find power supply problems? Where do we have a greater concentration of poverty? Where do we have a greater concentration of unemployment? What are the characteristics of these people? Ethnic characterization. And with this tool, the objective is to provide information for the policymakers so they can address properly each population, each group of the population. Also, it works as a monitoring and evaluation tool. As long as the Cadastro Único is everybody has to do how can I say, to update the information every 2 years. All information should be updated. So you can imagine the amount of effort that we have to do to have 100 million people with updated information every 2 years. So it's carried out by our ministry, the Ministry of Social Development, together with states and municipalities. So we can almost assure that every information that we have about this population is at least as new as 2 years old. So it's kind of a very usable information. Next, please. I'm trying to be as brief as I can, so I will almost finish with that. After this slide, there is a sequence that shows how you can access Cadastro Único's web page and how you can gather information. So feel free to go into this web page, and even after this webinar, if you have some questions, you can send us, and we will be glad to provide all information that you may want. So with this division of actors involved, we have the Social Development Ministry, that is us. The Caixa, that is the operating agent, is a federal, not only, but it's like a bank, a federal bank. We have states and we have municipalities. Talking with the organization, with social protection people, they send us some demands of questions that will guide us our presentation here regarding how Cadastro Único operates in the municipality. So I'll try to concentrate, give you some information, some data about this. Every municipality has its own social assistance department. It is not standardized. It can be a single social assistant, or it can be merged, it can be together with health, it can be together with education, with labor, with civil defense. You know, it varies a lot. But even though this kind of organization is not, we cannot interfere with this, we could reach that number that over 60% of the contact between municipalities and population and people happens on social assistance facilities. 60-some% happens in these facilities that we call CRAS, C-R-A-S, the CRAS. There are social assistance facilities that are responsible for basic services and social assistance. We have CRAS in almost 98% of Brazilian municipalities. That counts over 5,500 municipalities that has at least one CRAS in their administration. That's the local administration. The absolute number, it is 8,300 CRAS in Brazil, and we have also mobile teams. You can imagine how hard it is to reach people in the northern part of Brazil. So we have motorboats and other kinds of mobile teams. We have 1,200 more than this mobile teams working in Brazil, and they work also as a contact point between interface between Brazilian government and these people to provide the opportunity to be registered in the Cadastro. The CRAS, the social assistance facilities, last year we had over 16 million attendances, and almost 6 million families were referred to these facilities. And what is the importance of this when we're talking about single window services? It is because even though the single registry is a data bank, it is not only a data bank. It is a integration tool that brings people to local organizations. So once people get in touch with local services, they can also come back to them. And when they come back to these local services, social assistance services, they're already registered in the Cadastro Único, and they can be referred. They can be referred is the best word. They can be referred to whatever social policies they need. They can be taught about educational projects or programs, health programs, credit programs is also an important part of social assistance in Brazil. One important point to tell about the CRAS is that they are locally managed, but they are partially funded by federal government. So there is all CRAS are co-financed by federal government. Municipalities, they also spend money, they also spend their budgets to run the services by federal governments. They provide quite a help to the municipalities. Next, please. So these are some examples of what can be reached once people are inside the single registry. I'll not go over it one by one, but just some examples. Housing programs, retirement pension for low-income families, and the Bolsa Familia, the cash transfer program, not to mention all this. And this is not a final list. There are many other social policies that use Cadastro Único to know their beneficiaries and to better design their approach to population. Next, please. I think I'm finishing. Just some numbers. So we have 29 million people, almost 27 million families at single registry. And inside this number, we have 22 million families that are low-income families. This is, as I told you, almost half of Brazilian population that is inside our data bank. Next, please. Inside this population, we have 46% of they are until extreme poverty line, and 70% until poverty line. 22% they are until 50% of a minimum wage, and 12% over 50% of a minimum wage. So this tells us that Brazil is a country with a low medium wage. So half of the population of Brazil has this profile. Next, please. So as I told you, the next slides are just to show you. It will be available. We can send you the link to this presentation so you can go through these applications and go through this web pages. They are only in Portuguese. They are not translated to other languages, but you can translate it with Google Translator, or and even though if Google fails, I don't believe it, but sometimes it happens. We can try to answer your questions after this webinar, and I think we can finish now to have more time for questions. Thank you.
Thank you very much, Marcus. This was very interesting, I think, to all of us. I just want to remind to the audience that you can post your questions, which at the end we will then sort out and ask to all our panelists. So now I would like to invite our discussant team today. So we have Valerie Schmidt and Veronica Watzak from ILO, who will be discussing the content we just or commenting the content we just heard. So Valerie Schmidt is Deputy Director of Social Protection Department at ILO in Geneva, and she's also leading ILO's flagship program on building social protection floors for all. She holds a Master of Advanced Studies in Quantitative Economics from Paris Science Economics and a Master of Business Administration with honors from HEC. And she has 20 years of progressively responsible professional experience in the field of social protection, combining both headquarters and field experience in various types of organizations. And Veronica Watzak is an expert for ILO. In 2012, she worked for the Social Protection Floor Recommendations Commissions, and she holds a master's degree in international politics from the Queen's University of Canada, and she has also experience in the field of development cooperation in India, Ghana, and Honduras. I just quickly want to inform on some of the tools and toolkits which ILO works on, but also Valerie and Veronica can detail this more if there is time. So There is a toolkit which is already publicly available, and I will post the link soon, is the UNDG Social Protection Coordination Toolkit. And at the moment, they are also working on a comparative study on integrated mechanisms to deliver social protection to people, as well as on a good practices guide on national mechanism to deliver coordinated social protection floors. So Valerie and Veronica, please put your webcam on and just take over. Are you there?
Yes, I would think, Valerie, you're going to go first.
Can you hear me now?
Yes.
Yeah. Hello. Sorry, I had problems with so now I need to open my camera. Voila. Here, I am here. Hello, everybody. So I would like to start, and then maybe Veronica will come in, why the ILO is working on this single window service approach. For us, the starting point is the social protection floor and its recommendation that was adopted at the International Labour Conference by all our member states. So that include governments representatives, workers and employers representatives from 187 countries. And this social protection floor is about ensuring that the right to social protection can become a reality for all the population that today is excluded from it. And it has 4 basic guarantees, which means that countries should start by ensuring that access to healthcare, which is the first guarantee, benefits for children so that they can have proper nutrition, go to school, and develop themselves and escape child labor, which is the second guarantee. Then the third guarantee is about working age, so ensuring that people in working age, when they get injured or unemployed, or they need to go on maternity leave, so that they receive proper protection. And finally, the last guarantee is about older persons, ensuring that older persons, when they reach the retirement age, can have old age pensions. So you can see that the social protection floor is relatively broad in terms of the scope of benefits. And all these benefits can be under the responsibility of various ministries and institutions. In most of the national dialogues that we develop in the different countries to define what could be the social protection floor in this country, usually in the room we have around 50 institutions that can include Ministry of Health, Ministry of Labor, Social Welfare, Ministry of Agriculture in some cases, Ministry of Finance, Ministry of Education, and then you have different social security programs, social security institutions, our workers and employees organizations, the civil society, etc. So you can see that there's a large number of institutions and people that are really concerned by social protection. So this is about the policy design, where we try to really include everybody. But when it comes to implementation, and the single window service is about implementing social protection, and in our case, social protection floors, here again, it doesn't make sense for us, for the ILO, in developing countries, to have representation of the health ministry at local level, of the social welfare ministry at the local level, so labor ministry at the local level, and indeed, usually beyond the national level and regional level, maybe at the province, you will have representations of these different ministries, but when you go down to the local level, local communities, these ministries are just absent. So our idea was to ensure that there is a presence of these institutions and ministries at the local level, through maybe it can be in some cases the local government that can open a window or an office where people can really have access to social protection and to all the programs that exist at the national level and that compose the floor. So this was really the starting point and why we have started working on this idea of a single window, which means a physical place, an office that we symbolize by a small house, if you want. It can be a floor in a building. It can be a small house like we have in Mongolia or in Cambodia. Then it's a place that is playing different roles of coordination. The coordination of policies, because the single window is about giving access to different policies and programs and ensuring that the linkage between these programs are effective. For instance, if you give access to unemployment insurance benefits to unemployed people, and at the same time you give them access to vocational training so that they can increase their skill set, or you give them access to employment service centers so that they can really try to find adequate new jobs. This type of coordination is really ensuring that the different policies that should complement each other indeed talk to each other when it comes to the implementation. And coordination also exists between the central level and the local level, because if a scheme, a system, a policy is designed and implemented and put in the law at the national level in the capital city, it's very important that this law becomes a reality at the local level through this single window that helps to implement the law and ensuring that people really have access to their rights. Finally, for us, the single window service, the third aspect of it is a monitoring system and database management information system, so that we know exactly at any point in time who are the beneficiaries of all the programs, who gets benefits, who is still excluded, which villages don't have access to certain kind of benefits, etc., so that we have a better understanding of the real situation and real implementation of the social protection floor in the country, so that we can also improve the delivery. What is very interesting for us is that our social protection floor concept is embedded, as I said, in a recommendation, which is an international treaty called recommendation number 202. And this recommendation has a number of guiding principles that were approved, adopted, if you want, by the international community. When you read the recommendation, you have maybe 1 or 2 lines per guiding principle. It seems a bit theoretic, but if you start looking at how you could implement the recommendation, obviously this idea of single window will emerge, because it helps to really realize many of these guiding principles. One of the guiding principles is extension of social protection to everybody. It's universal social protection. And obviously, if you don't try to reach out to the people who are difficult to cover, the poor, the vulnerable, the rural populations, it's impossible to achieve universal social protection. So this is why this single window, by being very close to the population, for us is really a very good mechanism to reach out to those who are usually left behind. Another guiding principle is the responsiveness to the needs of the people. And here again, because at the single window level, you can have a case management system, you can have officers that know the programs, that are here to raise awareness, to share information, to help the people to fill the forms. Here again, you will respond to the needs of the people. If you have a family coming with 5 or 7 or 6 needs, social protection needs, one for the grandmother, one for the children, one for the mother who's going to deliver, etc., you can really have this case management approach and support the families. Another part, it's about a sound, transparent, accountable management and administration. And here again, we see in many countries that if you don't have a mechanism like a single window, which is attached to a database system that helps you to know exactly what's going on, where the money flows, who is covered, who is excluded, etc., you cannot have a sound management accountable system. So this is why for us it's so important also to have a single window in place. There are many other reasons, such as also what we what I mentioned already, the coordination of policies and the coordination of institutions that are also part of our guiding principles, and that can be established thanks to the single window. Another thing I wanted to mention is that for us, a single window is not only a technical tool that helps you to inform people, select them, enroll them, ensure that they can pay the contributions, do the case management, etc., etc. Of course, it's a technical tool, but not only. For us, it's also a way to empower people, and this is very important. For instance, through the appeals and the complaints and appeals mechanism that you can establish if you have a single window, because you can just imagine you can put a box of complaints, and this box includes people can post complaints, and then these complaints have to be solved, and if they are not solved, they can appeal, or if the decision is not exactly what they think that it should be, they can appeal of a decision. So this type of mechanism ensure that the system as a whole, the social protection system as a whole, is accountable. And for us, this contributes also to empower the people, because they see that their voice can be heard. Another way of empowering people for us is what we call social dialogue at the ILO. We try to, in all what we do, to ensure the participation of the representatives of the workers and their employers. In the case of the single window, if it's a single window that is established in and targets a population in the formal sector, we will try in the board and in the design first of the single window and in the governance structure to have representatives of workers' organizations. So it means trade unions and employers' organizations that can be a chamber of commerce or business associations. In rural areas, of course, we don't find representatives of workers and employers, and I was myself working in Cambodia on the development of this social service delivery mechanism, which is a single window, and there was no workers and no employers organization in the rural areas. So in such a case, we try to see what are the institutions that best represent the interest of these people and could defend them and ensure that their voice is heard. In some cases, it can be a committee of women and children, which exists in some countries. It can be a local association. It can be different things, or a mutual health organization, a cooperative. It can be different institutions from the social sector that represent the needs and the concerns of these people. And for us, it's very important that in the design and the implementation of the single window, these voices are heard, and they can be heard by ensuring this tripartite governance that needs to be reinvented in each country situation. The single window for us also improves social protection for two reasons. At the level of the people, this case management that we have discussed already ensures that the best options are found for the families, for the beneficiaries of social protection, so that if they need health plus maternity plus cash transfer, they can get this package, this full package that responds to their needs. In addition to that, a better social protection also means for us a progressive improvement of the policy design, because if you have all this monitoring and evaluation system, if you know exactly what's going on, if you can receive feedback also from the beneficiaries, you can also include this feedback, include this information in the design of the social protection system, and therefore you can improve the policy design. So single window for us, it means progressively improving social protection system so that it better answers the needs of the people. So as mentioned by our previous speakers, there is no one-size-fits-all approach. There are many models, etc. At the ILO, we are not so much in favor of models because, frankly, all the cases that we have documented, whether Cambodia, India, Indonesia, Mongolia, Uruguay, Brazil, Colombia, South Africa, are different. So in each case, you have different aspects. And so beyond documenting cases that can be a source of inspiration for all of us when we are into the design of a single window service, What is important also is to understand how to do it. It's what are the steps that are needed to design a single window in a participatory approach. So, for instance, we have some design studies. I forgot to give them, but I will give them to Alicia after the webinar. Such as this one was a feasibility study of the social service delivery mechanism in Cambodia. We have a similar study in Indonesia. I think when you read these design studies that are published and they are public knowledge, you understand all the process and you understand what needs to be taken into account, who are the interlocutors, etc. And finally, as Alicia mentioned already, Veronica and myself, we are working, and thanks to the huge work that had been done by our predecessor on this subject, Thibaut van Langenhof, who unfortunately is no longer at the ILO, we are committed to finalize a good practices guide on single window service. And I would like to take the opportunity of this webinar to ask whether some of you who feel that they are sort of experts on single window because they have some experience, some field experience on single window, could join us, and so that we could have a group of experts that would finalize this guide, so that we can really use it to promote this approach in different countries. I finish here, and Veronica, I hope you can take on now. Thank you.
Yes, thanks, Valerie. Well, I guess we've already taken up a lot of time, and I see that a lot of interesting questions are being asked through the chat bar, so I'm going to be super quick. Thanks a lot to both the very interesting presentations. I think it's a good combination of having a more global overview and then the very concrete example of Brazil, where we've seen really a lot of the challenges, and how in the case of Brazil they've been doing an excellent job in solving them. One of the questions that arises for me out of this is, I mean, a lot of the success stories that we see, like Brazil, Chile, South Africa, they're more on the middle income countries, because I mean, as we've heard, it is quite complex to build these structures, and in a way it requires a certain functionality already of the public administration and public services, and a lot of coordination among different government institutions. So I'm wondering if the two panelists could say a little bit more about the specific challenges and how they could be overcome in low-income countries. And then another thing that I found really interesting is where these slides, where the investment cost was compared to, on the one hand, benefits for the citizens, but also to the potential cost savings. And I would be interested to hear a little bit more about whether there's any concrete data or more concrete cost-benefit analysis of how these systems perform in terms of, I mean, it does require not only an investment cost to set them up, but also to keep them running, especially for reaching out to the remote areas and the most difficult to reach, that are often most in need. And on the other hand, of course, there's huge potential for cost savings by increasing the efficiency. And here, of course, the more programs that are integrated in the service, the more cost efficient it becomes because of economies of scale. So, but again, also the more complex it becomes and the more difficult and more demanding it will be to operate it. And this leads me to the third question with which I'm going to close. And this is this question of, in a lot of the literature on single window services, there seems to be a subtext of the more programs and the more services that can be integrated into the single window service, the better. And I mean, because of the economies of scale and efficiency, this is quite intuitive. On the other hand, I'm not sure whether this will always be true or always be the case. I mean, there's certainly a limit up to which, I mean, depending on the offices that need to deal with this, the amount of programs that they can actually be knowledgeable upon and that they can actually really handle in terms of providing services on them. Another concern that we haven't heard at all in neither of the two presentations, but that I think increasingly is a concern, is the question of data security and confidentiality of private information. And here, of course, the more programs and the more data is integrated in a single database, the greater the risk. So, I mean, some governments make very conscious decisions about not overdoing interoperability or integration of databases to ensure that that there is a certain confidentiality that can be guaranteed. So these were my three main points that I wanted to raise, and I think Alicia will have a lot of challenges to do with summarizing the questions, and then hopefully we have 20 minutes left for a good discussion on these.
Yes. So you already added a lot of questions, and so I think we can quickly jump into the final Q&A session, and I would like to ask everybody to put on the webcam. So Marcus, Martina, Veronica, and Valerie, so that we can see you all. So first, I would ask Marcus and or Martina if you want to answer or react to the questions which Veronica already put on the table. So maybe you just raise your hand who wants to start and go on.
So yes, I can start.
Okay.
Okay, so there was one question on how to implement single window services in low-income countries. So we have a lot of examples that are already on a country level rolled out in middle-income countries, but low-income countries still seem to face a challenge when implementing single window services, if I understood that correctly. So I think you're right, and also if you look at the country map that I was presenting, it's basically low-income countries that are still in a pilot stage. I think, and this brings me back a little bit to the modular approach that I was mentioning before. So for rolling out a single window service in a low-income country context, it is, I think, really good approach to just first test and prototype with a very small scale scope of services and scope of programs, what is feasible and what is working, and what also decentral level administrations can handle in terms of single window services before blowing it up and adding a lot of different social protection programs and extending the scope of services up to one-stop shop, for example. So I think this would be one approach how to address this problem. This is something that GIZ is also currently supporting in the case of Pakistan in two provinces, in Punjab and in Khyber Pakhtunkhwa. So there is some experience already that GIZ is collecting there in a low-income country context, and there it is basically prototyping the single window services on the local level, seeing what is working, what is not working, how to adapt it to the circumstances, and then rolling it out if it is feasible to roll it out. Yeah. Regarding I think this was also one question which was directed directly to me, which was the cost savings analysis. So there is no proper cost benefit analysis at the moment, as far as I know. So GIZ didn't do that, as far as I know so far. It's just this rough model that I also presented in my presentation, but there is of course room for cost benefit analysis, also taking into account the different experience of the different countries, and to see how much they invested and how much they really got out of the system related to demand side and supply side benefits. What else? Yeah, the question on data security. I'm definitely not a management information systems expert or single registry expert and so on. I think there is a lot of work being done also via socialprotection.org. I think there was a webinar a few months ago on this, and there is a publication which was I think, financed by DFID and done by Development Pathways, and they are dealing a lot with these issues on what is the difference between management information systems, between unified registry, between a single registry, and so on. And they are also dealing with this thing of data security, which of course always applies when it comes to a beneficiary registry in a single window service as well. I think there is a lot of work being done on that. And of course, this is an important issue that has to be taken into account. And was there another question? I think that's what I noted down. Yeah. Okay.
So Marcus, you want to answer to these previous questions, or you want me to add, because we received a lot of questions? You want me to add some of these questions we received, and then you give a summary on?
Okay,
yes?
I'll start with your questions about the security and the costs that Veronica has asked.
Okay, so yeah.
Is a great concern, and we have, it is the data bank is held by Caixa Econômica, is our federal bank. So there is enough worry, and there are the proper instruments to guarantee that the data is safe. Of course, there's no such thing as absolutely safe data, but we do our best to keep it safe. And about the costs, it's very difficult to tell you when you consider that over 20 social programs they use Cadastro Único database, but to give kind of a small image of our costs, the Bolsa Familia program, there's a cash transfer program. We have an annual budget of $8 billion, and the Cadastro Único costs less than 1% of this per year. So if you add all costs regarding all other social programs, it would be like 0.1% of what is included in all social programs. I'll try to answer quickly just one or two questions that were made here in the chat, on the box. They were asking about the Bolsa Familia, the cash transfer. Cash transfer and Cadastro Único, they are intimately imbricated. They were born together. So for a person to receive the Bolsa Familia, to get the cash transfer, everybody must be in the single registry. So this may be not clear, but there is no collision, there is no contradiction between the two databases, because there are no two databases. It's just one database. Everybody that receives the Bolsa Familia is registered in the Cadastro Único, and this does not happen with the government. In the beginning, it didn't happen with government looking for people, searching people. It was established the demand was from the people to government. So the local municipalities, the local governments, they provided services where people could go to the local governments, the local social assistance facilities, and they registered themselves in these facilities in order to receive the Bolsa Familia. In the Brazilian census, some 15 or 20 years ago, I don't remember in which census it was, we had a number of how many people were below the poverty line. So it was our challenge was to find these people in all over Brazilian territory. So at first it was the people looking for the government, but when certain time was a certain number of people was reached, this progression stopped, and we knew that some people were left behind. So we started with what we called active search. All municipalities were impelled, were kind of together in a great effort to find those people who didn't come to the government to register themselves, so they could access not only Bolsa Familia but all other social programs. So after some years, we've reached 100%, over 100%, because census was underestimating how many people were above poverty line. So if we compare to the census number, we reached 102%. It doesn't make sense to reach 102%, but it was this number because the original number was underestimated. So we kind of reached everybody that was on the poverty line is currently in the Cadastro Único. Of course, this is not true for one moment in time. There is always someone who is going to social assistance facilities now, as we are speaking here. Someone is looking for a social facility, social assistance facility in local governments in order to register he, she, or their families in this register. So I think we don't have any time left. So there are other questions, but I would be glad to answer it. A written answer, and then you could email this to people who have sent it to us, so that everybody could get their data. Okay. Thank you.
Thank you, Marcus. Actually, we still have around 8 minutes left until the official end of this webinar. So I would take the chance to ask some further questions from our audience. Maybe already in addition to what you said, Marcus, there is a question from Alexandra Plüschke from Pakistan. Who asks how the agents scheme works in the Bolsa Familia and also in the single windows service. So what is the contractual relation to the municipalities or federal government, and who pays them, and how are they paid for the service provision? Because they are setting up a similar scheme and would be interested in how this works.
Okay, this is interesting because I'm totally aware that it's hard to understand Brazilian federation model. It's really complex, and our constitution it divides services, divides responsibilities, and it's a constitutional command. So sometimes it doesn't make sense, but we still have to follow it. These agents, they are all local agents. They're all related to local governments. They are not federal agents, because the responsibility to provide social assistance services is constitutionally given to local governments, as well as primary education, as well as health in basic health services. So every local government has its social assistance department, and those agents are related to them. So they are paid by local governments. One important thing that we should mention is that federal governments transfer money to all local governments to co-fund all social assistance services. So they use this money also, this budget also, to pay their employees, their service. But this managing this relationship is only between local governments and their employees, their people. Okay.
Thank you, Marcos, for this clarification. So we received the proposal from the socialprotection.org team that we could extend this webinar for 10 more minutes, questioning our panel. Is that possible? There are still a lot of questions. If not, we really would have to come to an end. Yes?
That's fine, yeah.
Okay, for me it's okay, no problem.
Okay. So there were some specific questions to the presentation of Martina, but also I put them on the table to all of you. I think specifically the discussants, Valerie and Veronica, can also add up to this. So there was one from Eloa Prado on how to design a single Windows services tailored up on the gender lens, especially to deliver social protection for women. Is there any good practice regarding women's at the core of the initiatives? Then another question from Haryadi Erdian is on when you say that the challenge is the modular approach. Could you give more concrete examples of what that means? And a third question is on the difference between single Windows services and single registry, as well as case management. If you could elaborate further on that.
Okay. So yeah, I'm going to start with the question on gender and how single Windows services can improve access for women to social protection programs. I don't know really a best practice on how to how this is addressed. The only thing that comes up into my mind related to this is to closely involve the aspect of gender into the monitoring and evaluation system of the single Windows service approach. This has been done, for example, in the case of the pilot in Karnataka in India. So they had like one target to reach a certain amount, so like a certain percentage of women as their clients in the single Windows services. And at the same time, they were also giving kind of incentives to the social workers attending at the single Windows services based on their performance. So this is also how the social workers try to reach out and to reach women and to also include them into the single Windows services. This is one practical example that comes up into my mind when it comes to gender in single Windows services and how to better approach women. Of course, this is something that is very much related to the country context. I've been working for GIZ in Pakistan during the last months as well, and there the gender aspect is totally different because it's like culturally really difficult to in certain areas of Pakistan to bring women out of their houses and to approach administrative services, especially if they are if the workers there are male workers. So this is something that has to be taken into account on a very sensitive basis, especially in certain cultural contexts. Yeah, that's my experience from that. The second question was the modular approach. So I think that was maybe a mistake. It's not a challenge. It's kind of a certain way how to address the problem. And I mentioned it already in the question before, the question that was put also by Veronica when it comes to developing country context. So the modular approach is more or less like a proposal when it comes to single Windows services to develop first a prototype on a small scale with a small scope of programs and a small scope of services offered to see if this is working, and then to, let's say, improve what is not working before adding a lot of programs and this whole thing is not running at all. This is also something that was mentioned by Veronica in her comments. So is it really wise to put a lot of programs into the single Windows services, or is it better to concentrate on certain schemes that are well run and that are also proven to have an impact and not like to overload it with too many schemes and too many programs? And the third question, which was the difference between the single Windows service, the single registry, and the case management. I already mentioned before, I'm not an expert in, let's say, all these management information systems per se. For me, when it comes to single window service, a single, like let's say a beneficiary registry is one very important tool of the single window service, which complements the single window service, and which of course can then be linked to other instruments like the program management information systems. And the same is true for the case management. I think for the case management, we had a very good input from Valerie before. She was talking about the case management. The case management is something that is very different when we look at the different single window service country examples. We have a very specific case management in the case of Chile, for example, where social workers are following up with the families on a regular basis, like on a monthly basis, to provide them with needs-based social protection programs, and really to profile, to develop a profiling, and then to follow up on improving their social conditions. In other cases, this case management is rather, let's say, only focusing on registering beneficiaries into the beneficiary registry, which is then again a tool to support the case management. And then to follow up the applications and to see if applications are replied by the responsible authorities within time, and that people also get the feedback. So there are very different, let's say, approaches towards case management, but this relation between the two, between the three instruments mentioned, in the case of a single window service, beneficiary registry system has to be in place, and a certain approach for the case management has to be defined.
Yeah. Veronica, you want to add? Thank you, Martina.
Sure.
You want to add anything to that?
Regarding the gender question, I mean, this is tremendously important, and this year is actually a very fruitful year in this regard, as UN Women is currently preparing their flagship report on social protection. So that and there will be, if I can use this as a short advertisement, there's in fact a working group being set up by the Social Protection Interagency Cooperation Board for anyone who's interested to work on social protection and women and gender aspects. And there's also a guide coming out, and it will also touch on these questions of gender-sensitive social protection. And I fully agree with what Martina said. I mean, this is culturally very, very sensitive, and certainly also needs different solutions in different contexts. But it is very important to keep this in mind from the very beginning. Where the contact points are going to be set up, for example, where can people physically access the offices or the building? Is this close to a health center or close to a market, where we know that women often are engaged in market activities, or more often attend health centers, or close to primary schools? I mean, these points really matter. And as Martina said, who are going to be the officers if you have outreach activities that will be doing house visits, whatever? All these like nitty-gritty detail. I mean, this is just 1.5 hours. We can't discuss everything in detail, but at every step it will matter for whether it facilitates or creates obstacles for women to access. I mean, in this regard, I want to touch also on another question that I read that I thought was very interesting, and this is also related to this single window service, social registries, beneficiary registries, case management, how single window services can be used also for monitoring and evaluation purposes. I mean, this is more related, I guess, to the information system behind the single window service than the physical place. But the two are, I mean, as Martina just said, it's difficult to separate between these issues. But clearly, by integrating the services across various programs and having either a unified database or interoperable databases, will allow you to run different queries for producing certain analysis that can greatly facilitate monitoring and evaluation. And you will have a lot of the data much more easily available regarding coverage, ideally across different income, age groups, disaggregated by gender, etc. So, I mean, if properly managed, you really have a gold mine. Just accessing the administrative data from various schemes that should be kept on a routine basis to really see what is happening and measure progress. And this, of course, is also important in the context of measuring progress for the Sustainable Development Goals. Then the whole question about how do we disentangle single window services, single registries, case management, etc. I think, as Martina said, there's a lot of confusion around these terms, and they are not always used in the same way by the same agencies or people, or the same in academia. The same, I mean, like in IT community uses it different from social protection or development community often. But I mean, in a very simplistic manner, I would say when we talk about single window services, obviously we need all the IT, the software, the databases, etc. But the point that we want to focus the attention on, and that is important, is more that from a citizen or user perspective, to facilitate access and to make it easier for the citizens to process their applications, to assess their needs, to see what programs they may be eligible to, and thereby facilitate this government citizen interaction point across various. And I mean, I think we all come from a social protection community, but in the study by the GIZ, it is very much emphasized that actually a lot of these single window services, they also provide information or access to other public services that are not necessarily social protection. But it's really, I mean, it's the government citizen interaction point that we focus on when we talk about single window services. Then the single registry is one tool that is then used to manage data or information on potential or actual beneficiaries. And here I think it is very important to distinguish between a single registry that just collects data from different households, families, or individuals, and beneficiary registries. So you have a large database of potentially eligible persons, and this allows you to generate through various mechanisms, whether it's categorical targeting or means testing, and depending on the data that you have in the database, to generate program-specific beneficiary registries according to program-specific criteria. So again, you run a query against this general database, and you will generate specific beneficiary registries for each of your programs. That's the idea of a single registry that allows you to then have program-specific beneficiary registries. And then the case management, again, it's more the interrelation between like the public official or staff that accompanies a family or an individual to find their way through application processes and through on a needs assessment basis what programs they may be eligible to and how they can be followed up. And then we have the whole debate of graduation that comes in and all that. So, I mean, when we talk about case management, it's really how a family or household or individual is navigated through the entire system. I hope this clarifies it a little bit.
More than clarifying. And I think or you or Martina referred before to the online community on socialprotection.org, which is on single registry, has a lot of material and also webinars which took place. I think Brazil, Kenya, and other countries were presented there. So I would recommend also everybody to look into this community and the rich material which is there. Marcus, now we are already getting into the extension of 10 minutes. Although everybody is still on board, we only lost 3 participants from the audience, so it seems to be interesting still to everybody. Marcus, anything to add to these last questions, maybe on the gender issue regarding the Brazilian experience? That would be then the last contribution, and we would close afterwards.
Okay. I would say that not only gender policies, but the single registry and our version of single window service. One thing that I think it's important to tell is that single window service is a concept. It's an abstract concept that is not, possible to be carried out by some governments as a model, as a fixed model, as a concrete and unflexible model, non-flexible model. So as I mentioned before, as we are a federation with a very strict division of responsibilities, sometimes we just cannot do a single window service, a single window model as academia should, as academia used to tell us how it should be. But even though it's not perfect, it's what we are able to do, and we are trying to do our every day our best. But not only gender, but ethnic and affirmative actions and youth. I've seen some questions regarding youth and children and gender and all populational groups in society. Our single window single registry helps with this because it has information about these characteristics of the population. So public policies designed for women, they do use our information to know better what happens to women over our territory. And as social assistance services on the local governments, they are our window to these policies. They also gather much information about this, and they provide services directly to women, children, teenagers, youth, problems with everything related to vulnerable people, violence related to gender issues, to sexual orientation. All of these problems are summoned, resumed on our CRAS. Everybody looks for a CRAS. So it works both as a single registry point and a window to access all services. So there's a lot more to tell, but we are over time. So I'd like to thank everybody, and we are totally open to add as much information as we have, as we are able to, by email or whatever means you may find okay to do it. Thank you very much.
Thanks, Marcus. You took over my role. Thanks to all of you, the presenters and discussants. Valerie had to leave on time, so also Veronica, please tell her our thanks again. It was a very richful discussion. Thanks for all the questions from the participants. We try to get back to you if your questions haven't get answered in the last session, and also depending on the interest in the topic, GIZ is planning to make a webinar series out of this. So there are other country cases which could be presented, the ones of the study, but also the ones ILO just mentioned, and there are papers available. So please stay tuned and also participate at the short survey, which will show up after this webinar, so we can see where are your interests. And also thanks to the socialprotection.org team in Brazil, which always is very helpful in organizing and supporting these kind of webinars. So yes, thanks to all, goodbye, and until next time.
Thanks a lot, and thanks for organizing it. And if I just may say, so anyone who's interested in participating in drafting this good practice guide on single window services, please get in touch.
Okay, bye-bye.
Thanks, bye.
Bye, thanks.